Hi everyone, welcome to week 7. Just wanted to talk a little bit about policy analysis this week. You do have a health policy analysis checklist, a few other pieces of documentation that will be helpful to this topic as well as to your um, discussion this week in the Flipgrid. Chapter 10 is more general knowledge about ethics, the ethical approach to policy implementation, etc. So what I want to talk about, I'll leave you to your chapter. You can read that on your own. But what I will talk about this week is that policy analysis piece. So in the classroom, we have this document that is very detailed on policy analysis, great information. I'm not going to spend time going over that. What I do want to go over, the CDC has created a slightly more simple approach to policy analysis than that larger document. And I will put this in the classroom as well. So when we're talking about policy analysis, why are we talking about that? Why would you care as a healthcare administrator? Well, it's so important as an administrator at whatever level you're at. Could be the CEO, could be a middle manager in a hospital or in a health plan, etc. That you have the ability to do your own policy analysis. So rather than relying on, oftentimes when there's a new legal regulatory policy that's released, you'll see lots of folks doing analysis, doing interpretation, and posting it online. It's a great way to get a quick down and dirty look at a specific new rule, new policy, etc. However, you're relying on someone else's interpretation. So it's always great to have that skill set to be able to analyze policy, be it the highest level statutory law, be it an internal policy in your own organization, administrative type policy, and make your own decisions on how is this going to impact us? What have other experiences been, etc. So this checklist, and like I said, I will post this in the classroom as well, is a great way for you as a leader to be able to do your own policy analysis. Now, I will give one caveat. In large organizations like a UPMC or an AHN or those types of organizations, they will often have teams of attorneys that are tasked with doing analysis on behalf of your organization. And then they'll share things like white papers that will help you to better understand a rule. But I will say that as a leader, because ultimately I'm responsible for making sure that my area is compliant with whatever policy that is, as a leader, I still want to be able to take a look at something. Maybe that attorney that reviewed it that is, in the big building downtown doesn't understand how that's going to impact my department or my office individually. So it's always important to, you can always count on your attorneys in your organizations to provide you great information. And typically they will give you the official interpretation for your organization. But because as most everyone has probably figured out, there's a lot of gray area in the laws, policies, regulations that we have to follow in healthcare. So they'll give you the official interpretation of what they will support if perchance there is an action down the road that they need to defend. However, it's still really important that you as a manager, leader, do your own interpretation and perhaps share with them where you see there are troubles. Maybe there's problems that you wouldn't have resources to implement, or there would be unintended negative consequences. So really important that you have this skill set. So some of the questions, I'm not going to go through all of these. Like I said, I will post this up there in the classroom, but I thought it would be helpful. This first set of questions is really important. So this first question, what is the policy lever? And what this means is who's pulling the lever on this, to put it most simply. Who is telling us that this is policy? So is it legislative? So is it a statutory law? Is it regulatory? Those are our administrative laws. Or maybe coming from an organization like the Joint Commission, that's regulatory. Administrative tends to be, when you're talking about policy, is stuff coming from within your organization. So where is the lever? At what level does the policy lever lie? And that's important to know. So an example I did some work in New York State on Medicaid reform. And this was just a couple years back. The Medicaid Inspector General in New York State has a whole list of things that, from a compliance perspective, providers, be it hospitals or individual provider offices, have to do to remain compliant with their policies. Then they also have kind of another list over here. So here's compliance regulations, and that's the minimum standard that you have to meet. But over here, there's a kind of a group of best practices that are the gold standard. So minimum standard, gold standard. And there's a little bit of room in between where you can fall based on your ability to implement these policies. So I had the opportunity, like I said, to work on this Medicaid reform project. I was working for a general organization that was working. They were the group that would collect the money from the state and parse it out to providers to help to implement some of this policy. One of the things that was brought up by this group was that they had to meet this minimum standard of checking, kind of doing background checks on vendors, and that they had to do it honestly in an unreasonable amount of time and an unreasonable amount of times per year. So we got talking about that, and so I dug into it a little further, and that whole notion of background checks on references or background checks on vendors is a best standard. Now, we do have to do some, but there's a minimum standard that must be met. And then there's this best practice standard up here. And as long as you're somewhere between those two, or even above that higher one, then you're okay. The problem was this group they didn't understand the policy lever. They saw it as they had to do it. They had to do this thing that was over here on the right when actually you only had to do what was on the left. So it took some time and these were compliance officers. These were folks that had a similar background to mine, but they were just so fearful of what the Medicaid Inspector General would do if they didn't meet that higher standard, because when they get audited, they are audited against this higher standard. Well, I needed to explain to them that they do have the ability to be in between those two, because the policy lever is here, not here. This is what you want to do in the best circumstance. The policy lever is down here. So it's really important to understand, is what you're doing mandatory? How do we, how will we enforce it? Those types of things. Who's responsible for administering the policy? All really important. And a lot of that goes back to the policy lever itself. Enforcement is another thing that's important to look at. Who's tasked with enforcement of a policy? So let's say new regulations come out from Center for Medicare and Medicaid Services with regard to a specific quality measure, and you are going in and taking care of this, looking through data, checking through your records to get information to implement this policy regarding this quality measure. What's important is you need to know who's responsible for enforcing this. So if you are at the high level, and you're having folks go through and do these tasks to pull this data out of your system, Medicare, CMS, doesn't care if you do it or not. If you don't do it, you'll receive less payment. If you do it, you'll get potentially higher payment. But they're not going to enforce it. The only enforcement that they're going to do is, well, if you provide it, good, and if you don't, then we'll take it out of your payment. Enforcement in that case needs to be done in the organization. You need to enforce that this is happening so that you don't take that cut in payment. But then there are other times when enforcement is done at the regulatory level, statutory level, for example, HIPAA. So if there's a HIPAA violation, when HIPAA first came about, we were responsible for administering our own enforcement guidelines. So we would fire people, we would put them on leave, we would do further education, etc. But then they started doing their own enforcement. The Office for Civil Rights is responsible for coming out and making sure that HIPAA privacy and security are being enforced. And that's why you'll see now all of these multitude of enforcement actions, because we weren't doing a good job of enforcing it internally, and they were still seeing a large number of breaches. So they're coming out and doing random audits and looking at places to make sure that things are being actually done properly and handling that enforcement end. Lots of other things you want to look at. What are the objectives of a policy? What's the legal landscape surrounding the policy? A good example there is, for example, the ACA. when that first came about, there was a lot of questioning about constitutionality, and it needed to go through the court process to determine if it was constitutional or not. So sometimes there is some legal wranglings or even just policy wranglings going on in the background. Oftentimes, CMS will come out with a plan to make a change in payment or structure of their systems, and then there's such a backlash that they end up changing their change before it's actually implemented. So it's really important to understand the background context, the legal landscape, etc. What are the experiences of other jurisdictions? So I'll reference back to my Medicaid reform experience in New York. That process that we were doing in New York State had been completed in Texas the year before. So we were able to talk to colleagues down there, see how they were doing things, how they were managing things, how they were going forward in implementing this policy and in making changes to improve the Medicaid system. So you don't have to recreate the wheel. If someone else has gone through a similar or the same process, sometimes you can get some insight from them. Probably the last one I want to focus on here is the unintended positive and negative consequences of the policy. So sometimes we have a policy that has great intent. Maybe it's to streamline operations, provide better care to patients, provide better access. But sometimes things have negative consequences that were not intended. So a good example comes from our synchronous session the other day, and one of the students in the class is looking at medical marijuana. So in a state where medical marijuana is accessible to those that have appropriate conditions and appropriate prescriptions from their physician, this is the positive aspect of that is to provide this medical marijuana to offset the use of narcotic pain relievers. So trying to fix that opioid issue and other narcotic pain relievers, but fix that and impact the increased use of medical marijuana. Well, what happens if one of these patients that has medical marijuana as pain relief for chronic pain or migraines or whatever it is that they may have, goes to the hospital, and maybe they end up in the hospital for a general health condition, like maybe they have a heart attack, or maybe they have an issue with diabetes, or even if they go to the hospital and have to have surgery, something like that. In some states, this one, Pennsylvania being one, there are some restrictions on the use of narcotic pain relievers in patients that access medical marijuana. So what happens, they can't use their medical marijuana in the hospital, but they can't have certain pain relievers either. So you can't expect someone that just had open heart surgery to deal with their pain using Tylenol or Advil. So how do you do that? How do you help that patient? That was an unintended negative consequence of that policy. Had great intentions, but an unintended consequence is that, in fact, these patients can't have certain pain relievers. Another unintended consequence is patients that are using medical marijuana to deal with things like chronic pain or migraines. I don't think it's covered for migraines in Pennsylvania, but it is in other states. But then what happens when those folks get drug tested at work? Maybe they work in a place where you have random drug testing every so often. You could be completely capable of completing your job if you use marijuana 4 days before, but it's still going to show up in your system. So how is that managed? How is that whole process managed? So lots of unintended consequences of policies. Sometimes they're positive, but sometimes they're negative. So important to look at those types of things. Impact on your population. So from a public health standpoint, obviously the population for folks and professionals in public health is very broad, but you can look at it as your population too, in your facility, your organization. How does this policy impact your population? Feasibility is also very important. So these are good questions to look at from a feasibility standpoint. How scalable is it? How flexible is it? For example, that kind of two steps for the Medicaid Inspector General. Down here was the minimum, up here is the top, and you can actually be anywhere in between and still be compliant, still be legal. So if there are many policies that are scalable like that, and so how scalable is it? How flexible is it? How many resources is it going to require, etc. Kind of digging in further to that resource aspect, what are the costs and benefits associated with the policy? What is our return on investment? Lots of things there. So you can use these questions, and like I said, again, I'll put this up in the classroom. But you can use these questions to analyze any policies, and you can use them to help you develop policy if that's something you need to be doing. You can use them to help implement policy in your organization, and you can use these questions to look at policies that exist for your final paper as well. So this could be helpful if you perhaps haven't looked at some of these areas. For your policies that you're looking at to then develop new policy. So some of these things will help you identify where those holes are in policy and will help you to further identify additional policy. So this week, again, we have our final project that's due by the end of the week. We do have a discussion and our quiz. Obviously, we always have our quiz, but that's that's the limit to our work for this week. I will put in a brief plug for week 8 now. Remember that week 8 is a short week. It goes Monday to Friday. So your work needs to be completed by Friday. The only work that we'll have next week are a short lecture, probably just to do some wrap up, and then the discussion. There is also a second discussion that is optional. There are no points associated with it. But it's just for you. It's a written discussion board for you to give us feedback on the class and things you liked, things you didn't like. How can we improve? We really, hopefully you've figured this out by now, but we really thrive on your feedback, positive or negative. We want to make changes where we can. We want to add more topics to these classes. Every class goes through a fairly extensive revision before it's taught again. So really important that if you feel free sharing, share feedback in this public forum. If you'd rather just provide feedback directly to me, drop me a note, stop by and see me, give me a call. And then you'll also have your survey at the end that you can provide feedback. The problem with those surveys is that it takes a long time for them to get back to us, unfortunately. So sometimes I'm rewriting a class before I get the feedback back. So that's why we like this real-time format, but always feel free to share feedback in that anonymous forum as well if you would rather do that with your class surveys. So that's all I have. Hopefully I'll see you in the Flipgrids this week. Please let me know if you have any question with regard to the final project, anything else regarding the class, and try to enjoy your last 2 weeks of summer before we get back to the grind of classes in the fall, although you guys take as many classes summer, spring, and fall. So you hopefully you were able to enjoy some good weather this summer, although it's been a bit warm, but enjoy the weather, get out, enjoy family and friends and whatnot before kids go back to school and all of those things. So enjoy your last couple of weeks of summer. I'll see everyone in the Flipgrid. Thanks.